The presence of an ammonia-like breath odor is often an early yet overlooked indicator of kidney dysfunction. This phenomenon occurs when the kidneys fail to adequately filter out waste products, leading to an accumulation of urea in the bloodstream. Under normal circumstances, the kidneys play a critical role in maintaining homeostasis by filtering excess fluids and waste from the blood, which is then excreted as urine. However, when the kidneys are compromised, urea remains in the bloodstream and eventually breaks down into ammonia. This metabolic byproduct is then exhaled through the breath, resulting in a distinct metallic or chemical-like odor that can be highly unpleasant. In a healthy individual, urea is formed in the liver as part of the body's nitrogen waste elimination process. Proteins consumed in the diet are broken down into amino acids, and the excess nitrogen is converted into urea, which is transported to the kidneys for excretion. When kidney function declines, this process is disrupted, causing an increase in blood urea nitrogen (BUN) levels. As a result, the excess urea that the body is unable to eliminate through urination begins to accumulate in various tissues and fluids, including saliva. This leads to the conversion of urea into ammonia by oral bacteria, which produces the characteristic foul breath associated with kidney dysfunction. One of the significant challenges in diagnosing kidney disease early is that symptoms often develop gradually and can be mistaken for less severe health issues. For instance, a person experiencing bad breath might initially attribute it to poor oral hygiene or dietary choices rather than an underlying renal problem. However, ammonia-like breath odor is not influenced by oral hygiene practices, as it stems from systemic metabolic dysfunction rather than localized bacterial activity in the mouth. This distinction is crucial for early detection, as patients may continue to brush and floss rigorously without seeing any improvement in their breath odor. The connection between kidney function and halitosis has been extensively studied, with medical research highlighting the role of metabolic imbalances in altering body odor. In individuals with chronic kidney disease (CKD), the buildup of metabolic waste products is not limited to ammonia. Other toxins, such as indoxyl sulfate and p-cresyl sulfate, also contribute to systemic toxicity. These compounds can further exacerbate symptoms like metallic taste, nausea, and loss of appetite, making daily life increasingly uncomfortable for affected individuals. A clinical case study involving patients with end-stage renal disease (ESRD) demonstrated that nearly all individuals exhibited some form of breath odor alteration. This was particularly pronounced in those undergoing dialysis, as the treatment, while effective at removing some waste products, does not fully restore the kidney's ability to regulate metabolic balance. The severity of ammonia-like breath odor correlated with the level of uremia, reinforcing the idea that monitoring breath odor could serve as a supplementary diagnostic tool for assessing kidney function. Another critical aspect of ammonia-like breath odor in kidney disease is its psychological and social impact on patients. Many individuals suffering from CKD report experiencing embarrassment and self-consciousness due to persistent halitosis, which can affect their personal and professional relationships. The odor can be strong enough to be noticed by others, leading to social withdrawal and decreased quality of life. This underscores the importance of raising awareness about the medical significance of breath changes and encouraging individuals to seek medical evaluation if they experience unexplained alterations in breath odor. To illustrate the metabolic pathway leading to ammonia-like breath, consider an individual with moderate kidney impairment who consumes a protein-rich meal. As the proteins are digested, the body generates nitrogenous waste, which, under normal conditions, would be efficiently filtered out by the kidneys. However, in a person with compromised renal function, this waste remains in circulation, leading to an increase in blood urea levels. Over time, the excess urea diffuses into the salivary glands, where it is metabolized into ammonia, creating a distinctive odor that is noticeable upon exhalation. This example highlights how dietary habits can influence the severity of halitosis in kidney disease patients and underscores the importance of dietary modifications in managing symptoms. Furthermore, ammonia-like breath odor can also be an indicator of the severity of kidney disease progression. In early-stage CKD, waste accumulation may be relatively mild, leading to intermittent or barely perceptible changes in breath odor. However, as kidney function declines further, the intensity of the odor typically increases, becoming more persistent and pronounced. This progression underscores the value of breath odor as a potential early warning sign, prompting timely medical intervention before the disease reaches an advanced stage. Medical professionals often assess kidney function through blood and urine tests, such as measuring creatinine levels and glomerular filtration rate (GFR). However, given the non-invasive nature of breath analysis, researchers are exploring the potential of breath biomarkers as a complementary diagnostic tool. Some studies have suggested that breath analysis could provide real-time insights into metabolic changes associated with CKD, reducing the need for more invasive testing methods. This area of research is particularly promising, as it could lead to earlier detection and improved management strategies for individuals at risk of developing kidney disease. Aside from CKD, other conditions can contribute to ammonia-like breath odor, including liver disease, metabolic disorders, and severe dehydration. Therefore, while halitosis alone is not definitive proof of kidney dysfunction, it serves as an important clue that should not be ignored. Individuals experiencing persistent bad breath with a metallic taste should consider undergoing a comprehensive medical evaluation to determine the underlying cause and rule out serious health conditions. In addition to medical intervention, lifestyle modifications play a crucial role in managing kidney health and reducing symptoms like ammonia-like breath. Dietary adjustments, such as reducing protein intake, limiting sodium consumption, and increasing hydration, can help lighten the metabolic load on the kidneys. Patients with CKD are often advised to follow a renal-friendly diet tailored to their specific stage of kidney impairment, as improper dietary choices can accelerate disease progression and exacerbate symptoms. Hydration is another key factor in mitigating ammonia-like breath odor. Drinking sufficient water helps flush out toxins and prevents excessive urea buildup, thereby reducing the intensity of breath odor. However, hydration needs vary depending on the severity of kidney disease. For individuals in advanced stages of CKD, fluid intake must be carefully monitored to avoid complications such as fluid overload and hypertension. Consulting a nephrologist or registered dietitian is essential for developing a personalized dietary and hydration plan that supports kidney function while minimizing unwanted symptoms. In summary, ammonia-like breath odor is a significant yet often unnoticed sign of kidney dysfunction, arising from the body's inability to properly filter and excrete nitrogenous waste. It serves as an early warning sign that warrants medical attention, especially in individuals with additional risk factors such as diabetes, hypertension, or a family history of kidney disease. While traditional diagnostic methods remain the gold standard for assessing renal health, breath odor analysis presents a promising avenue for early detection and disease monitoring. Addressing underlying metabolic imbalances through dietary and lifestyle modifications can help alleviate symptoms and improve the overall well-being of individuals affected by kidney disease. Foamy or bubbly urine is often overlooked as a minor occurrence, yet it can be an essential indicator of kidney function impairment. While occasional foam in the urine is typically harmless and results from the speed or force of urination, persistent foamy urine may signal a deeper issue, particularly protein leakage, known as proteinuria. Understanding the physiological mechanisms behind this condition, its implications, and the diagnostic approaches can help in recognizing and addressing potential kidney damage before it progresses. Under normal circumstances, the kidneys act as highly selective filters, allowing waste products and excess fluids to pass into the urine while retaining essential proteins like albumin. The integrity of the glomerular filtration barrier is crucial in preventing protein loss. This filtration system comprises endothelial cells, the glomerular basement membrane, and podocytes, which work in tandem to ensure that proteins remain in the bloodstream. When this filtration barrier is compromised due to kidney damage, proteins leak into the urine, leading to proteinuria. Because proteins lower the surface tension of urine, their presence creates persistent foam, similar to the effect seen when soap or detergents are added to water. The degree of proteinuria can vary, ranging from mild to severe. In mild cases, the condition may be transient and caused by factors such as dehydration, stress, or strenuous exercise. However, persistent or severe proteinuria often suggests chronic kidney disease (CKD) or other serious renal disorders. Nephrotic syndrome, a condition characterized by significant protein loss, hypoalbuminemia, and edema, is a prominent cause of foamy urine. Patients with nephrotic syndrome often exhibit swelling in the legs, around the eyes, or in the abdomen due to reduced oncotic pressure in the blood, as albumin, a key protein responsible for maintaining fluid balance, is lost in large quantities. Beyond nephrotic syndrome, foamy urine can indicate other kidney pathologies, including glomerulonephritis, diabetic nephropathy, and hypertensive nephrosclerosis. Glomerulonephritis, an inflammatory condition affecting the kidney's glomeruli, disrupts the filtration process, leading to increased permeability and protein leakage. This condition may arise due to infections, autoimmune diseases such as lupus, or vasculitic disorders. Patients with glomerulonephritis may experience hematuria, hypertension, and reduced kidney function alongside foamy urine. Diabetic nephropathy, a leading cause of chronic kidney disease worldwide, is another critical condition associated with proteinuria. In diabetes, prolonged high blood sugar levels damage the delicate structures of the kidneys, particularly the glomeruli. As the filtration barrier deteriorates, albumin begins to leak into the urine, often serving as an early marker of kidney damage. Microalbuminuria, the presence of small amounts of albumin in the urine, is an early warning sign that precedes overt proteinuria and significant renal dysfunction. Early detection and management of diabetes-related kidney damage can slow disease progression and prevent complications such as end-stage renal disease (ESRD), which requires dialysis or kidney transplantation. Hypertension also plays a significant role in kidney health. Chronic high blood pressure can damage the small blood vessels in the kidneys, impairing their ability to filter waste and retain necessary proteins. Over time, this damage leads to proteinuria, a sign of deteriorating renal function. Managing blood pressure through lifestyle modifications, medication, and dietary adjustments can help mitigate the impact on kidney health and reduce the likelihood of developing proteinuria-related complications. While kidney disease is a primary cause of persistent foamy urine, other conditions may also contribute to its presence. Urinary tract infections (UTIs) and dehydration can temporarily alter urine composition and appearance. UTIs may cause the presence of excess white blood cells or bacteria in the urine, leading to frothiness. In such cases, additional symptoms like burning during urination, fever, and urgency to urinate may be present. Dehydration, on the other hand, results in concentrated urine, which may appear darker and produce foam due to its high solute content. Certain lifestyle factors and dietary choices can also influence urine composition. High protein intake, particularly from animal sources such as red meat, eggs, and dairy, increases the load on the kidneys, potentially leading to transient proteinuria. Athletes or individuals consuming large amounts of protein supplements may notice foamy urine, which usually resolves with adequate hydration and balanced protein consumption. Similarly, medications such as nonsteroidal anti-inflammatory drugs (NSAIDs), certain antibiotics, and angiotensin-converting enzyme (ACE) inhibitors may impact kidney function and contribute to proteinuria. Diagnosing the underlying cause of foamy urine involves a thorough clinical evaluation, including laboratory tests and imaging studies. A urinalysis is the primary diagnostic tool used to detect protein levels in the urine. The presence of albumin above normal thresholds often warrants further investigation. A 24-hour urine protein test or urine protein to creatinine ratio (UPCR) provides a more accurate assessment of protein excretion and helps determine the severity of proteinuria. Blood tests, including serum creatinine, estimated glomerular filtration rate (eGFR), and blood urea nitrogen (BUN), assess overall kidney function. Elevated creatinine levels and a reduced eGFR indicate impaired filtration capacity, suggesting kidney disease. Additional tests, such as kidney ultrasound or biopsy, may be required in cases where the cause of proteinuria is unclear or when an autoimmune or inflammatory condition is suspected. Early detection and intervention are crucial in managing proteinuria and preventing further kidney damage. Treatment strategies depend on the underlying cause. In cases of diabetic nephropathy, tight glycemic control through medications like insulin or SGLT2 inhibitors can slow disease progression. Similarly, antihypertensive agents such as ACE inhibitors and angiotensin II receptor blockers (ARBs) have been shown to reduce proteinuria and protect kidney function by lowering blood pressure and decreasing glomerular hypertension. For individuals with nephrotic syndrome or glomerulonephritis, immunosuppressive therapy, corticosteroids, and dietary modifications may be necessary. Reducing sodium intake, maintaining adequate hydration, and consuming a balanced diet rich in fruits, vegetables, and lean proteins can support kidney health and minimize protein loss. Lifestyle modifications, including weight management, regular exercise, and smoking cessation, further contribute to overall kidney function preservation. In cases where foamy urine is transient and not linked to kidney disease, simple measures such as increasing water intake and moderating protein consumption can help normalize urine appearance. However, persistent or worsening foamy urine should never be ignored, as it may indicate progressive renal impairment. Educational awareness about kidney health is essential in preventing chronic kidney disease and its complications. Many individuals remain unaware of their kidney function status until significant damage has occurred. Routine health checkups, including urine and blood tests, can aid in early detection and timely intervention. Ultimately, recognizing foamy urine as a potential warning sign rather than a benign anomaly empowers individuals to seek medical evaluation and adopt proactive measures to safeguard their kidney health. The kidneys play a vital role in overall well-being, and any indication of their dysfunction should prompt immediate attention and appropriate medical care. Swollen ankles and feet are a common but often overlooked sign of kidney dysfunction. When the kidneys are unable to properly filter waste and excess fluids from the blood, the body retains water, leading to noticeable swelling. This swelling, known as edema, is particularly visible in the lower extremities because gravity causes fluid to accumulate in the feet and ankles. The underlying mechanisms of this process are complex, involving intricate interactions between kidney function, circulatory health, and electrolyte balance. One of the primary causes of swelling in individuals with kidney dysfunction is sodium retention. The kidneys play a critical role in maintaining the body's sodium balance by excreting excess amounts through urine. However, when kidney function declines, sodium accumulates in the bloodstream, causing the body to retain water in an attempt to dilute the concentration of sodium. This leads to an increase in blood volume, which places extra pressure on blood vessels. The resulting fluid leakage into surrounding tissues contributes to the swelling seen in the ankles and feet. Patients with chronic kidney disease (CKD) often experience worsening edema over time as their kidneys lose the ability to regulate fluid and sodium effectively. Another contributing factor to edema in kidney dysfunction is a decrease in albumin levels. Albumin, a protein produced by the liver, helps maintain oncotic pressure, which is essential for keeping fluid within the blood vessels. When kidney disease progresses, protein loss occurs due to damage to the glomeruli, the kidney's filtering units. This condition, known as nephrotic syndrome, leads to a significant drop in albumin levels, resulting in reduced oncotic pressure. As a consequence, fluid escapes from blood vessels into surrounding tissues, exacerbating swelling. This is why individuals with severe kidney disease often present with not only swollen ankles and feet but also generalized swelling in other parts of the body, such as the hands, face, and abdomen. The renin-angiotensin-aldosterone system (ROS) also plays a pivotal role in fluid retention associated with kidney dysfunction. The kidneys regulate blood pressure by controlling the release of renin, an enzyme that triggers a cascade of hormonal responses. When kidney function declines, the ROS becomes overactive, leading to excessive production of aldosterone, a hormone responsible for sodium and water retention. Increased aldosterone levels cause the body to hold onto more fluid, further contributing to the swelling observed in the lower extremities. This mechanism is particularly relevant in individuals with hypertension-related kidney damage, where high blood pressure exacerbates fluid retention, creating a vicious cycle of worsening kidney function and edema. Another critical factor in swelling associated with kidney dysfunction is the impact of impaired lymphatic drainage. The lymphatic system is responsible for removing excess fluids and waste products from tissues. When kidney disease progresses, the ability of the lymphatic system to clear accumulated fluid diminishes, leading to further buildup in the feet and ankles. This can be particularly problematic in individuals with advanced CKD or those undergoing dialysis, where lymphatic function may be further compromised due to fluid overload and systemic inflammation. The cardiovascular system also plays a crucial role in the development of edema in kidney disease. The heart and kidneys work closely together to maintain fluid balance and blood pressure. When the kidneys fail to excrete excess fluid efficiently, the additional volume puts strain on the heart, potentially leading to congestive heart failure (CHF). In CHF, the heart's ability to pump blood effectively is compromised, causing fluid to back up into the venous system. This results in increased hydrostatic pressure, forcing fluid out of blood vessels and into surrounding tissues, further worsening swelling in the ankles and feet. Many patients with both CKD and CHF experience severe and persistent edema, requiring medical intervention to manage their fluid levels. Inflammatory processes also contribute to fluid retention in kidney disease. Chronic kidney disease is associated with systemic inflammation, which affects blood vessel integrity and permeability. Inflammatory cytokines released during kidney dysfunction can alter vascular function, making blood vessels more permeable and allowing fluid to leak into surrounding tissues. This inflammatory response can be exacerbated by comorbid conditions such as diabetes, which further impairs kidney function and accelerates fluid retention. Patients with diabetic nephropathy often experience significant lower extremity swelling due to the combined effects of inflammation, poor circulation, and kidney impairment. In some cases, swollen ankles and feet may be an early indicator of kidney dysfunction before other symptoms become apparent. Many individuals with mild to moderate kidney impairment do not experience noticeable changes in urination or electrolyte balance, but they may develop subtle signs of fluid retention. This makes it crucial for healthcare providers to recognize and evaluate edema in at-risk individuals, such as those with diabetes, hypertension, or a family history of kidney disease. Early detection and management of kidney dysfunction can help prevent further progression and reduce the severity of fluid retention. For individuals experiencing swelling due to kidney dysfunction, lifestyle modifications and medical interventions can help manage symptoms. Reducing sodium intake is one of the most effective ways to minimize fluid retention. A low-sodium diet helps prevent excessive water retention by decreasing the body's sodium load. In addition, maintaining proper hydration is essential, as dehydration can signal the body to retain more fluid, worsening swelling. Patients are often advised to monitor their fluid intake based on their kidney function, as excessive consumption can contribute to fluid overload in individuals with advanced kidney disease. Medical management of edema in kidney disease often involves the use of diuretics. These medications help the body eliminate excess fluid by increasing urine output. However, their use must be carefully monitored, as overuse can lead to dehydration and electrolyte imbalances, which may further harm kidney function. Loop diuretics, such as furosemide, are commonly prescribed for patients with kidney-related edema, but their effectiveness depends on the severity of kidney impairment. In some cases, combination therapy with other diuretics may be required to achieve optimal fluid balance. Compression therapy is another approach used to alleviate swelling in the lower extremities. Compression stockings help improve circulation by preventing fluid from pooling in the ankles and feet. This method is particularly beneficial for individuals with mild to moderate edema who do not require intensive medical treatment. Elevating the legs above heart level for extended periods can also help reduce swelling by promoting fluid drainage through the lymphatic and venous systems. In severe cases of kidney dysfunction, dialysis may be necessary to manage fluid overload and prevent complications associated with excessive swelling. Dialysis helps remove waste products, excess fluids, and electrolytes from the blood, restoring balance to the body. Patients undergoing hemodialysis often experience a significant reduction in swelling following treatment, as excess fluid is effectively removed. However, maintaining proper fluid balance between dialysis sessions is critical to preventing recurrent edema. Swollen ankles and feet due to kidney dysfunction can have a profound impact on an individual's quality of life. Persistent edema can cause discomfort, limit mobility, and increase the risk of skin breakdown and infections. The presence of swelling can also be psychologically distressing, as it serves as a visible reminder of declining kidney health. Addressing the root cause of fluid retention through proper medical management and lifestyle changes is essential to improving overall well-being and preventing further complications. Understanding the intricate mechanisms behind fluid retention in kidney disease highlights the importance of proactive kidney care. By recognizing swelling as an early warning sign of kidney dysfunction, individuals can take appropriate steps to protect their kidney health and seek timely medical intervention. Healthcare providers play a crucial role in educating patients about the significance of edema and guiding them toward effective management strategies. As kidney disease continues to be a global health concern, raising awareness about its symptoms, including swollen ankles and feet, remains essential in promoting early detection and improving patient outcomes. Shortness of breath is a significant and often overlooked symptom of kidney dysfunction, arising from multiple physiological imbalances that affect oxygen levels and respiratory function. The kidneys play an essential role in maintaining homeostasis by filtering waste, regulating blood pressure, balancing electrolytes, and producing hormones necessary for red blood cell formation. When kidney function declines, the consequences extend beyond waste accumulation, influencing various bodily systems, including the cardiovascular and respiratory systems, which in turn can lead to breathing difficulties. One of the primary mechanisms through which kidney disease contributes to shortness of breath is fluid overload, leading to pulmonary edema. The kidneys regulate the body's fluid balance by filtering excess water and sodium. However, when they fail, fluid begins to accumulate in tissues, including the lungs, causing congestion. This results in pulmonary edema, a condition in which excess fluid fills the alveoli, the tiny air sacs in the lungs responsible for oxygen exchange. Pulmonary edema impairs gas exchange, making it difficult for oxygen to enter the bloodstream and carbon dioxide to be expelled. The result is a sensation of breathlessness, particularly when lying down or engaging in physical activity. Patients experiencing this condition often find it difficult to sleep and may wake up gasping for air. This fluid buildup is particularly dangerous because it can lead to acute respiratory distress and requires immediate medical intervention. Another contributing factor to shortness of breath in kidney disease is anemia, a common complication of chronic kidney disease (CKD). The kidneys produce erythropoietin, a hormone that stimulates the bone marrow to produce red blood cells. When kidney function declines, erythropoietin production decreases, leading to a reduced red blood cell count and, consequently, lower oxygen delivery to tissues. Anemia-induced shortness of breath is exacerbated by increased cardiac demand, as the heart must work harder to compensate for the lack of oxygenated blood. This additional strain can lead to left ventricular hypertrophy and heart failure, further exacerbating respiratory difficulties. Patients with anemia-related breathlessness often experience fatigue, dizziness, and palpitations, compounding their discomfort. Moreover, kidney dysfunction disrupts electrolyte balance, which plays a critical role in muscle function, including that of the diaphragm and other respiratory muscles. Potassium imbalances, in particular, can cause muscle weakness or even paralysis in severe cases, impairing the body's ability to breathe efficiently. Hyperkalemia, or high potassium levels, is a common occurrence in advanced kidney disease due to reduced excretion, affecting neuromuscular function and leading to respiratory distress. Similarly, metabolic acidosis, another consequence of kidney failure, results in an increased acid load in the blood. This can trigger compensatory hyperventilation, known as Kussmaul breathing, characterized by deep, labored breathing as the body attempts to correct the pH imbalance. In some cases, kidney disease contributes to fluid retention around the heart, leading to pericardial effusion, a condition in which excess fluid accumulates in the pericardial sac. This places pressure on the heart, reducing its ability to pump effectively and leading to congestive heart failure. Since heart and lung function are closely interconnected, pericardial effusion can result in breathlessness, even at rest. Patients with this condition may experience orthopnea, a difficulty in breathing while lying flat, which is relieved by sitting upright. The impact of kidney disease on the respiratory system can also be indirect, arising from the consequences of systemic inflammation. Uremic toxins that accumulate in the bloodstream due to impaired kidney function contribute to inflammation and vascular damage, affecting lung tissue. Chronic inflammation may lead to increased vascular permeability, exacerbating pulmonary edema and reducing lung compliance. The result is an increased sensation of breathlessness and a greater susceptibility to respiratory infections, which further strain already compromised lung function. Additionally, sleep disturbances are prevalent among individuals with kidney disease and can contribute to worsening respiratory symptoms. Sleep apnea, a condition characterized by repeated episodes of breathing cessation during sleep, is more common in patients with CKD. This condition arises due to multiple factors, including fluid shifts to the upper airway, metabolic imbalances, and autonomic dysfunction. Obstructive sleep apnea causes intermittent hypoxia, placing further stress on the cardiovascular and respiratory systems, while central sleep apnea, also observed in CKD patients, results from disruptions in the brain's respiratory control centers. Both forms of sleep apnea contribute to daytime breathlessness, fatigue, and an increased risk of cardiovascular complications. The relationship between kidney disease and respiratory distress highlights the intricate connection between the renal, cardiovascular, and pulmonary systems. Management strategies for addressing breathlessness in kidney disease depend on identifying and treating the underlying causes. Diuretics are commonly used to reduce fluid retention and alleviate pulmonary congestion, but their effectiveness diminishes in advanced kidney failure. Oxygen therapy may be required in severe cases of respiratory distress to ensure adequate oxygenation. Erythropoiesis-stimulating agents (ESAs) and iron supplementation are often prescribed to manage anemia and improve oxygen transport. In cases of severe electrolyte imbalance, dialysis may be necessary to restore normal potassium and acid-base levels. Lifestyle modifications also play a crucial role in mitigating breathlessness associated with kidney disease. Sodium restriction can help manage fluid retention, reducing the likelihood of pulmonary edema. Regular monitoring of blood pressure and blood sugar levels is essential in preventing further kidney damage, particularly in individuals with diabetes or hypertension. Engaging in low-intensity physical activity, as tolerated, can improve cardiovascular fitness and respiratory endurance. Weight management and smoking cessation further contribute to improved lung function and overall health. Given the multifaceted causes of shortness of breath in kidney disease, a multidisciplinary approach involving nephrologists, cardiologists, and pulmonologists is often required for comprehensive management. Early detection of kidney dysfunction through routine blood and urine tests can help prevent complications that lead to respiratory distress. Patient education on recognizing symptoms such as swelling, fatigue, and changes in urine output can facilitate early intervention and improve outcomes. The association between kidney disease and respiratory impairment underscores the importance of kidney health in overall well-being. Recognizing and addressing the contributing factors to shortness of breath in CKD can significantly enhance quality of life and reduce the risk of life-threatening complications. By taking proactive measures to manage kidney function, individuals can minimize respiratory difficulties and maintain optimal health despite the challenges posed by kidney disease. Protecting kidney health is crucial for overall well-being, as these vital organs are responsible for filtering waste, regulating electrolytes, and maintaining fluid balance in the body. When kidney function is compromised, toxins accumulate, leading to various health complications. Understanding how to support kidney function through hydration, blood pressure control, and regular checkups can prevent long-term damage and improve overall health. Hydration plays a pivotal role in maintaining kidney function, as these organs rely on a steady flow of fluids to effectively filter waste products from the blood. Water helps dissolve nutrients, flush out toxins, and prevent the formation of kidney stones. Insufficient hydration can lead to concentrated urine, which increases the risk of urinary tract infections and kidney stone formation. Dehydration also causes the kidneys to work harder to filter waste, which may lead to damage over time. The ideal amount of water intake varies based on factors such as age, weight, climate, and physical activity levels. While the general recommendation is around 8 glasses per day, individuals with kidney conditions may need personalized guidelines from healthcare providers. Excessive water consumption, however, can also be harmful, especially for individuals with kidney disease, as their kidneys may struggle to eliminate excess fluids, leading to swelling and high blood pressure. Thus, maintaining a balanced water intake tailored to individual needs is essential for kidney health. Monitoring blood pressure is another crucial aspect of kidney protection, as high blood pressure damages the small blood vessels in the kidneys, impairing their ability to filter waste effectively. The kidneys regulate blood pressure through the renin-angiotensin system, which controls fluid balance and vascular resistance. When blood pressure remains elevated for extended periods, it exerts excessive pressure on the delicate kidney structures, leading to scarring and reduced function. This creates a vicious cycle in which impaired kidneys further contribute to high blood pressure by failing to regulate fluid and electrolyte balance properly. Individuals with hypertension must adopt lifestyle modifications, such as reducing sodium intake, engaging in regular physical activity, and managing stress levels. A diet rich in potassium, found in foods like bananas, oranges, and spinach, can help counteract the effects of sodium and support healthy blood pressure levels. Additionally, medications such as angiotensin-converting enzyme ACE inhibitors or angiotensin receptor blockers ARBs may be prescribed to protect kidney function by lowering blood pressure. Consistently monitoring blood pressure at home and during medical visits allows for early detection of abnormalities and timely intervention. Regular checkups are essential for identifying kidney disease in its early stages before significant damage occurs. Many kidney conditions, including chronic kidney disease (CKD), develop silently, with symptoms appearing only in advanced stages. Routine blood tests measuring creatinine levels, blood urea nitrogen (BUN), and glomerular filtration rate (GFR) provide valuable insights into kidney function. A declining GFR indicates reduced kidney efficiency, signaling potential problems. Urinalysis is another important diagnostic tool, as it can detect proteinuria, excess protein in the urine, a sign of kidney damage. Individuals with risk factors such as diabetes, hypertension, or a family history of kidney disease should undergo regular screenings to detect early signs of dysfunction. Early diagnosis allows for timely interventions, such as lifestyle modifications and medications, to slow disease progression and prevent complications. Regular checkups also provide an opportunity to assess overall health, adjust treatment plans, and receive personalized guidance from healthcare professionals. Aside from hydration, blood pressure control, and checkups, several additional strategies support kidney health. A balanced diet rich in fresh fruits, vegetables, lean proteins, and whole grains minimizes strain on the kidneys. Reducing processed foods, which often contain excessive sodium and unhealthy fats, helps prevent hypertension and fluid retention. Maintaining a healthy weight reduces the risk of obesity-related kidney disease, while regular exercise enhances circulation and promotes cardiovascular health, benefiting kidney function. Avoiding excessive use of nonsteroidal anti-inflammatory drugs (NSAIDs) such as ibuprofen and naproxen, protects the kidneys from damage caused by prolonged medication use. Smoking cessation is another key factor, as smoking restricts blood flow to the kidneys, accelerating decline in function. In summary, maintaining kidney health requires a proactive approach involving proper hydration, blood pressure management, and regular medical checkups. These measures not only protect kidney function but also contribute to overall well-being by reducing the risk of chronic diseases. Understanding the importance of these habits and implementing them consistently can significantly improve long-term kidney health and prevent severe complications.